Hello, my name is Fatima Mariscal and I am studying medicine at the UAEM faculty, and in this video we will talk about Alzheimer. So let's get started.
My name is Itzel Saavedra Radilla. We are studying our third semester in the medical career and we will be presenting Alzheimer's disease for our English course. Alzheimer's disease. To start, we will see that Alzheimer's disease is a brain disorder that gets worse over time and it is the most common cause of dementia. It produces changes in the brain that lead to the deposit of certain proteins and it causes the brain to shrink and brain cells to eventually die. Some of the early signs of the disease include forgetting recent events or conversations, and over time it progresses to serious memory problems and loss of the ability to perform everyday tasks like eating or drinking water, going to the bathroom, etc. Um, about its etiology, we will see that it is thought to be caused by the abnormal buildup of proteins in and around the brain cells. A healthy human contains about 86 billion neurons, and one neuron may connect with up to 10,000 other neurons, passing signals via 1,000 trillion synaptic connections. In the Alzheimer's disease, we will see that it leads to a gradual and irreversible loss of many of these neurons and synapses. Also, there's a decrease in the neurotransmitters, which are in charge of sending messages or signals between brain cells, and one that is particularly low is the acetylcholine. Different areas of the brain shrink, and the first areas are usually affected are responsible for the memories, like entorhinal cortex and hippocampus.
Pathophysiology of Alzheimer's disease. The two pathologic hallmarks of Alzheimer's disease are one, extracellular beta amyloid deposit in neurotic plaques. And the second is intracellular neurofibrillary tangles, paired helical filaments. The beta amyloid deposition and neurofibrillary tangles lead to loss of synapses and neurons, which results in a gross atrophy of the affected areas of the brain, typically starting at the mesial temporal lobe. The mechanism by which beta-amyloid peptide and neurofibrillary tangles cause such damage is incompletely understood. There are several theories. Uh, the one theory is the amyloid posits that progressive accumulation of beta-amyloid in the brain triggers a complex cascade of events ending in a neural cell death, loss of neural synapses, and progressive neurotransmitter deficits. All, all of their effects contribute to the clinical symptom of dementia or Alzheimer. The second is a sustained, sustained immune response and inflammation have been observed in the brain of patients with Alzheimer's disease. Some experts have proposed that inflammation is the third core pathologic feature of Alzheimer's disease. The third is glucose metabolism der derangement has been show to play a potentially important role in the development of Alzheimer's disease. Prion mechanisms have been identified in Alzheimer's disease in a prion disease and normal cell surface brain protein called prion. The protein becomes misfolded into a pathogenic form termed a prion. The prion then causes other prion proteins to misfold similarly, resulting in a marked increase in the abnormal proteins, which led to brain damage in Alzheimer's disease. It is thought that the beta amyloid in cerebral amyloid deposits and tau in the neurofibrillary tangles have a prion-like self-replicating uh, properties. And here Here we have an image that shows us the normal brain, the brain damaged by Alzheimer's, and the brain damaged by dementia. Epidemiology. The Mexican government tells us that it is estimated that approximately 1.3 million people in Mexico suffer from Alzheimer's disease, a figure that represents between 60 and 70% of dementia diagnoses and most frequently affects people over the age of 65. The World Health Organization (WHO) estimates that approximately and 60 million people worldwide are living with Alzheimer's disease, of which 8.1% are women and 5.4% are over the age are men and 2 in the age of 65. Now we I say conclusion of the epidemiology. The prevalence and incidence of dementia increase exponentially after the age of 65 years, as a consequence of progressive population aging and increased life expectancy. The number of dementia cases will increase over the coming decades. Recent studies point to a slight decrease in the cumulative risk of dementia adjusted for the age and the sex during the last decades in some countries. It is possible that through primary prevention strategies on known dementia risk factors, the burden the burden of dementia on public health may decrease in the future.
Symptoms. In Alzheimer's disease, we will see a progression of symptoms, and each progression and development of the disease is different for each individual. We can divide the symptoms in three main stages. The first one is the early symptoms, and it is mainly Uh, we will see memory lapses. Some of the examples of these memory lapses are forgetting about recent conversations or events, misplacing items, forgetting the names of places and objects, having trouble thinking of the right word, asking questions repetitively, showing poor judgment or finding it harder to make decisions, and becoming less flexible and more hesitant to try new things. And sometimes we will also see signs of mood change, such as increasing anxiety of agitation or periods of confusion. In middle stage symptoms, we will see increasing confusion and disorientation, obsessive, repetitive, and impulsive behavior, delusions or feeling paranoid and suspicious about carers or family members, problems with speech or language, which is known as aphasia, disturbed sleep, changes in mood, such as frequent mood swings, depression and feelings, increasing anxiety, and frustrated or agitated, difficulty performing special tasks, such as judging distances and seeing or hearing things that other people do not, are hallucinations. Some people may also have symptoms of vascular dementia. And finally, the later symptoms are dysphagia, which is having trouble eating, difficulty changing positions or moving around without assistance, weight loss that can be severe sometimes, urinary incontinence or bowel incontinence, gradual loss of speech, significant problems with short and long term memory, and we will also see that hallucinations and delusions may come and go over the course of the illness, but can get worse as the condition progresses. Sometimes people with Alzheimer's disease can be violent, demanding, and suspicious of those around them. About the clinical manifestations of Alzheimer's disease, we will see that sometimes, since it's a disease uh, in that presents in older ages, uh, people will think that it is a sign of aging, but it can be confusing. And the National Institute on Aging and Alzheimer's Association uh, claims that Alzheimer's disease can be differentiated because it interferes with the ability to function at work or at usual activities. It represents a decline from previous levels of functioning and performing, and it is not explained by delirium or major psychiatric disorder. And we will also see cognitive impairment that is detected and diagnosed through a combination of history taken from the patient and a knowledge informant and an objective cognitive assessment, either a bedside mental status examination or neuropsychological testing.
Diagnostic. There are several ways to diagnose Alzheimer's disease dementia. Often, this disease is diagnosed with a medical examination. Doctors will evaluate the things and symptoms already mentioned and perform various tests. They may talk with family and friends to learn more about the symptoms and behavior. It is important to have an accurate diagnosis of Alzheimer's disease, which is the most common type of dementia. And um, correct diagnosis is the first important step in getting treatment, medical care, family education, and proper plans for the future. During the appointment, the doctor will evaluate the following: whether you have impaired memory and reasoning cognitive skills, whether you have behavioral or personality change, the degree of memory or reasoning impairment of change in your memory reasoning, how the reasoning problems affect your ability uh, to function in daily life. The cause of your symptoms. Um, Probably doctors may order other laboratory or imaging tests of the brain, or order a detailed memory test. These tests can provide doctors with useful diagnostic information, such as ruling out other conditions that cause similar symptoms. And for that, we have some tests. We have mental status tests to assess your reasoning, cognitive, and memory skills. Neuropsychological testing. Testing by neuropsychologists. The evaluation may include a comprehensive test to assess memory and reasoning cognitive skills. They provide information about what you can still do and also about what you may have lost. These tests can also determine whether depression may be causing your symptoms. In interviews with family and friends and doctors, ask uh, your family or friends questions about the patient and his or her behavior. And we have laboratory tests. Laboratory tests to rule out other disorders that cause symptoms similar to those of Alzheimer's disease dementia, such as thyroid disorders of vitamin B12 insufficiency. The physician may recommend a cerebrospinal fluid examination to arrive at a diagnosis. Levels of amyloid and tau protein can be measured in the cerebrospinal fluid. The proportion of these proteins can help determine if Alzheimer's disease is present. In most cases of Alzheimer's disease, a cerebrospinal fluid examination is not necessary, but may be useful in a typical rapidly progressing case. Mm, in this, we have a brain imaging test. Magnetic resonance imaging uses powerful radio waves and magnets to create a detailed image of the brain. Computed tomography uses X-rays to obtain cross-sectional images of the brain. Positron emission tomography (PET) uh, uses a radioactive substance known as a radioactive tracer to detect substance in the body. This scan can identify brain regions with impaired glucose metabolism. The pattern of change in metabolism serves to distinguish different types of degenerative brain disease. Brain imaging tests can help to do the following, and can rule out other causes such as hemorrhages, brain tumors, or strokes. Distinguish different types of degenerative brain disease and establish a baseline value for degree of degeneration. The first picture is a magnetic magnetic resonance imaging. The second one is computed tomography, and the last is positron emission tomography. A bit. Now we have a conclusion of diagnostic. And in the past, Alzheimer's disease was diagnosed with a certainty only after death, when observation of the brain with a microscope revealed plaques and tangles. Healthcare providers and researchers um, can now diagnose Alzheimer's disease during life with greater certainty. We have advanced in diagnostic, and as we have seen, it is important to diagnose early to prevent serious effects on the patient's life and to begin treatment. So let's get started with the treatment. Treatment. Medications of Alzheimer's disease can help with symptoms that affect the memory and other cognitive things. Currently, two types of medication are used to treat the symptoms. The first is cholinesterase inhibitors work by increasing the level of communication between walls. These drugs preserve a neurotransmitter that is depleted in the brain by Alzheimer's disease. These are usually the first medication tried, and most people see mild improvements in symptoms. They may improve symptoms related to behavior such as agitation or depression. Medications are taken by mouth or administered through a skin patch in the skin. Um, the following are commonly prescribed, like donepezil, Aricept, Atlarity, galantamine, Rasadine, and the transdermal patch with rivastigmine. Excellent. The main side effects of these drugs are diarrhea, nausea, loss, loss of appetite, and sleep disturbance. People with certain hair disorders may experience serious side effects, such as irregular heartbeat. Mm, Next, we have memantine, memantine, Nameda. This drug works on other brain neuron communication network and slow progression of symptoms in moderate to severe Alzheimer's disease. It is sometimes used in a combination with a cholinesterase inhibitor. Relatively rare side effects include dizziness and disorientation. An important part of any treatment plan is adapting to the needs of persons with Alzheimer's disease. Establish and strengthen routine habits and reduce tasks that require the use of memory. These measures can make life much easier. And um, this there are steps to help a person not lose a sense of well-being or the continuity ability to function, such of as the following. Just like keep case, wallets, cell phones, and other valuables in the same place in the house so they are not lost. And something like keep medication in a safe place and use a daily checklist to keeping track of dosages. To arrange for financial transition to made by automatic payment or deposits. Make sure the person with Alzheimer disease carries a cell phone with a tracking system. Program important contact numbers into the phone. Install alarm sensors on doors or windows and make sure regular medical appointments as much as possible are on the same day and at the same time. This is the most important for the treatment with the drugs. Use a calendar or a whiteboard to keep track of daily tasks. Get in the habit of crossing up of complete tasks and remove excess furniture, rugs, and clutter. Place sturdy handrails of stairs and in bedrooms. And make sure doors and sleeper and comfortable and provide good transition, traction. Um, Reduce the number of mirrors because the people with Alzheimer disease may be confused of or afraid of seeing images in the mirrors because they don't recognize that person in the mirror. And make sure the person with Alzheimer disease carries identification or wears a medical alert bracelet in case this person is lost. Keep photos and other significant objects in the house because that makes feel comfortable. And the the last one is a conclusion of the treatment. In general, the treatment is based on reducing the discomfort that is disease can cause, and this improve the quality of life of these people, and as already mentioned, requires too much support from family members. So mm, that people needs uh, really too much from family members. And it is that for my part, and thanks for listening.
To give a general conclusion about Alzheimer's disease, it is a brain disorder that gets worse over time. It is characterized by changes in the brain that lead to deposit of certain proteins It is thought to be caused by abnormal buildup of proteins in and around the brain cells, and the two pathological hallmarks of Alzheimer's disease is extracellular beta amyloid deposits and intracellular neurofibrillary tangles. In Mexico, 1.3 million people suffer from this sickness, and 60 million people worldwide have Alzheimer's disease. The symptoms may be divided in early symptoms, middle stage symptoms, and later symptoms, and the progression of these stages is different for each individual. Even though the treatment is not specific, it may slow down the progression of the disease, and it is important that the family and carers know how to treat with a person that changes their personality and is completely different since the disease.